Hello?
Yes, next for the second
Okay.
slide. Okay,
Okay.
okay, that's all of the content of my point of my presentation. And then next slide.
Sorry, I can't hear you clearly.
Okay, next slide, Miss.
Okay.
Okay, um, from the literature, we know that COVID-19 report at the first time in Wuhan, 2019, its high infectivity and fatality rate. The World Health Organization declared that the outbreak of a COVID-19 as a public health emergency of international concern on January 2020 and declared it was a pandemic on March 2020. Because of high infectivity, high fatality rate, and misleading media about a COVID-19 can contribute to stigma. Stigma is a negative association between a person or group of people with a specific disease. Stigma can occur to the patient, family, healthcare worker, and the community. But in these articles, authors only concerned about a stigma in COVID-19 patient. Stigma associated with COVID-19 serious threat to the life of patient and survivor of the disease. Next. Okay, that's our objective. The aim of the study to analyze the impact of stigma on patients with a COVID-19. Next. Okay. Um, Method of the study is literature review. We use a search engine Google Scholar, PubMed, Dutch, Science Direct, and ResearchGate. We use keywords, COVID, impact, and stigma. The years of publication in uh, 2020. We get some articles and we have a criteria, so only some articles that we reviewed. Next. Okay. That is the title of article that we reviewed. From this article, um, we review about the aim, the sample size, and the result of the article. Next. Okay, from the literature, we know that kind of stigma. There are external stigma and internal stigma. The form of external stigma is labeled stereotype, threat, spiritually, rejection, racism, marginalization, and discriminate with all the existing socioeconomic consequences. The impact of the stigma is people are afraid to test for COVID because they afraid will be labeled and also being led to the hospital or medical care, hiding their previous medical history or travel history. Yeah. As a result of this action, the transmission of a COVID has increased. In addition, social economic problem in COVID patient also have a significant impact. In the other hand, internal stigma um, is a stigma that comes from the sufferer himself. They feel guilty because infecting their relative and lovely family. They feel anger at themselves, rejecting their self and thinking about why God punish me and my family. The impact of internal stigma create a psychological problem for sufferer. And if it's not resolved, it will be lead to depression. So mental health professional services need for reduce a negative impact of internal stigma. To eliminate the stigma, we need a positive media campaign and education. Further need a policy to prevent a negative impact of stigma. Um, I think enough of my presentation. Thank you for the attention. Assalamualaikum warahmatullahi wabarakatuh.
Warahmatullahi wabarakatuh.
Moderator still mute.
Okay, sorry, thank you for the presentation. And then we move to another participant, Wiwin Sulistiawati, Indah Jayani, Susmiati, Endang Meilanita, Arif Nurma Etika. Okay, I'm gonna share the presentation. Pak, dia enggak. Okay, I'm sorry about the trouble. And please welcome Wiwin Sulistiawati, Indah Jayani, Susmiati, Endang Meilania, Arif Dharma Etika. The time is 10 minutes, so please do the presentation.
Okay, thanks for the time. I will present my paper, which title of the use of telehealth in outpatient department during the COVID-19 pandemic, lateral review. My team are Wiwin Sristiawati, Indah Jayani, Susmiati, Endang Mayunalia, and Arif Nurma Atika. Okay, next slide, please. My content, background, object and a method, result and discussion, and acknowledgement. Next slide, please. Okay. The background is in the COVID-19 pandemic, physical distancing has been necessary to help prevent disease transmission. This makes outpatient avoid and avoid both going to the hospital. Telehealth is one of the solutions for treating patients in the COVID-19 pandemic. Telehealth help patients consult with health professionals to get a cure. The application of telehealth in outpatient service is carried out by several methods. Okay, next. Objective. The purpose of the regulatory review is to identify the telehealth methods used in outpatient department during the COVID-19 pandemic. And okay, this is a method of the database used in making this review are ScienceDirect, EBSCOhost, and Google Scholar that published in 2020. This related review searched for studies with the keywords telehealth, telemedicine, outpatient, COVID-19 pandemic, and selected 4 articles from electronic database. Okay, next. This is the result. There are 4 articles that selected. The first article from Tom Sokri, Jessica et al. The title is Telemedicine in the Era of the COVID-19 Implication in Facial Plastic Surgery. The article tells about telemedicine that used in facial plastic surgery are live teleconsultation, live visit via Zoom, and American Well platform. The second article from my chat, Dagubati and Daniel. The title is Telemedicine for Outpatient Neurosurgical Oncology Care. Lesson learned for the future during the COVID-19 pandemic. Telemedicine specific consideration for each step and stakeholder of the appointment, physician, patient scheduling, pre-visit imaging, and physical examination are estimated. The third article from Miho Tanaka, the title is Telemedicine in the Era of COVID-19, the Virtual Orthopedic Examination. The paper tells about telemedicine that used in orthopedic are virtual visit, virtual examination. And the last article from Nicole and Kragnitsky et al. The title is Prime for a Pandemic Implementation of Telehealth Outpatient Monitoring for Women with Mild COVID-19. They use a virtual telemonitoring clinics for obstetric patients. Okay, next slide. Nah, this is a discussion. Telemedicine, the provision of clinical services via the use of communication technology between patient and providers, is one such result that may be effectively implemented during this time, the pandemic of COVID-19. Telemedicine may refer to transfer of static image or video between patient and physician via mobile device, or the use of audiovisual telecommunication software to facilitate correspondence in real time. The telemedicine method that is applied to facial plastic surgery is via live teleconsultation for the initial consultation and in the postoperative setting to evaluate the healing of the surgical site and patient concern. A virtual telemonitoring clinic for obstetric patients with mild COVID-19 offers an effective surveillance strategy as it allows for close monitoring, direct connection to in-person evaluation, minimization of patient and provider exposure, and scalability. Implementation of the telemedicine in orthopedic case is virtual orthopedic examination. At the time of scheduling, patients are asked to prepare for their virtual visit and are given a checklist. In addition to confirming audiovisual capabilities prior to the visit, patients are given specific instructions on the camera positioning, body positioning, setting, and other to improve the efficiency of the visit. Next slide. Conclusion. Telemedicine is an alternative health service program that can be applied to outpatient department during the COVID-19 pandemic. The use of telemedicine in outpatient department is suitable for minimizing transmission of COVID-19 and minimizing direct contact between health worker and patient. The telehealth and outpatient department method is carried out by several methods, include live teleconsultation, live visit, virtual examination, completing the virtual assessment, and telemonitoring virtual clinics. Okay. The next. Conflict of interest. There is no conflict of interest. The author wishes to thank all research collaboration from Kadiri University. And thank you all committee and all participants. Thank you for committee the second study international conference on health. Okay, I finish my presentation. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you for the presentation about use of telehealth in outpatient setting during the pandemic COVID-19, a literature review. And then we move to the next participant. Okay, we move to the next participant is please welcome Dr. Sentot Imam Suprato with the title Strategic Development to Accelerate Healing in Several Cases of COVID-19 Infection with Convalescent Plasma Therapy, a Literature Review System. Please welcome Dr. Sentot.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Ladies and gentlemen, I want to report with my review literature. And now the time is the worldwide of the in the world is pandemic COVID. My title is strategic development of decrease. Yeah, if decrease accelerated mortality, decrease accelerate to mortality by COVID-19 infection with convalescent plasma therapy. Next. The problem in the world is morbidity, is mortality, mortality rate to increase, not driven. Yeah. And the next. And what the world weight problem in 2020. The problem is a COVID-19 pandemic. The pandemic to multi-dimension. What's the effect? The effect is in health. Okay, we don't know someone which positive or negative. In education classroom, no. In economic, direct session, no. In tourism, it's correct. Next. And the pandemic, I want to say with a flash flood cases pandemic COVID pandemic 19. Why flash flood? Flash flood in Indonesia adalah banjir bandang. Flash flood cases not to driven with all of the world. Next. In the worldwide, problem in the worldwide. In the world, positive is 24 million now. And recovery is a good 60.5 million. The recovery may be 60 and to 70% recovery. And now is much difficult as death. Death is 822,233. And the next, okay, we know worldwide pandemic from Chinese to Europe is the most a pandemic in Italy and France and to USA is a pandemic to Indonesia and Aussie, Australia. And next, pandemic, COVID pandemic is emerging collaborative. Yeah, it's emerging collaborative. In Indonesia, trial, domestic to trial to emerging collaborative. In Bandung, 196, 98, 96 probandus to the trial get vaccination by with Sinovac vaccine from Chinese. And now to report, but not especially to symptom or sign which post vaccination, like this Governor West Java. Yeah. And Surabaya trial about multi-drug oral drug to COVID. In hospital, referral hospital trial, why and when we can drive someone to make not die. A referral hospital trial which plasma convalescent. Plasma convalescent is product of plasma from the human post-viral COVID-19 infection. In Chinese, it's a good. The result of the trial is a good. 3 days, the symptom and the sign, the clinic is decreased. Important clinic is a dyspnea in Chinese, yeah. In the hospital, dyspnea minimalized, and after the thorax function, it's minimalized of secret in lung. It's a good. In India, it's a good. And Indonesia, in Padang, in Denpasar. Okay, the next. In Indonesia, a domestic pandemic positive is 132,000. And yesterday is the maximal new positive 3,000 one day. And the death is Indonesia 7,000. But Angeles, my friend, my colleague, 89 dead by COVID. 89. My friend, my teacher, my junior, it's not especially.
Mr. Senta,
And yes,
your time
the
is
time?
1 minute left.
Okay. Okay. And in pandemic is emergency collaboration in community, in individual, and government and social and community must to be a collaboration, emergency collaboration. The problem is not individual problem. The problem is problem of the whole in the world. Yeah. And one, I want to my close. Uh, we must out of the box research. If everything research, the time during 3 to 6 years, especially in pandemic about during 6 months, is out of the box. Thank you. And with my participation, my suggestion, community must be obeyed. And isolatif is okay, is kolaborasi, is intensive early stage must be to therapy with plasma convalescent.
Mr. Sentot, I'm
And
sorry your time.
yes, okay, thank you. The problem, worldwide problem, emergency collaboration, and plasma convalescent is a drug of choice. Thank you, and I'm sorry. Thank you.
You're welcome. Thank you for the presentation about the strategy development to accelerate healing in several cases of COVID-19 infection with convalescent plasma therapy, a literature review system. So we move to next participant. Bu Arina. Okay, the next participant is please welcome Ms. Arina Chusnayatini with the title The Use of Sonication Method for Reducing Size of Liposomes in Papaya Leaf Extract or Carica papayalin preparation as a candidate in treatment of cervical cancer. Time is yours.
Okay, thank you for the time, Ms. Vijay. And I would like to explain about our research. This research is conducted with my team. There are Dr. Yuli Priyustawati and also Professor Dr. Sandu Sioto and also with Dr. Kusnadi and the last one with Dr. Haryono MMSC. And the title is the use of sonication method for reducing size of liposome in papaya leaf extract preparation as a candidate in treatment of cervical cancer. Can you hear my voice?
Yeah, I can hear your voice.
Okay. Next slide, please. Okay, for the background, liposome are physical shape participle whose walls are composed of lipid molecules, and the liposome from papaya leaf extract, or we call as Carica papaya line, are made with the aim of increasing the effectiveness of the drug and biochemical work, as well as the protecting healthy tissue from the toxic effect of the drug. And the Carica papaya is one of the plants known to have the anti-cancer properties. And this Carica papaya has the active substance which are called as alkaloid that can be played a role in inhibitory activity against the DNA enzyme topoisomerase II. And for the treatment, the liposome from papaya leaf extract can inhibiting cell proliferation and by enhancing apoptotic inductions. Next. And the purpose of this research is to know the produce an extract of liposome from papaya leaf phospholipid formulation using a combination of heating and sonication as a candidate in the treatment of cervical cancer. And for the next, there are some material and also method that we used, and this study using descriptive explanatory method, which use papaya leaf as extract using methanol to make liposomes. And there are some material that used in this research. For the first one, we prepare or we use soybean, and then the second one we use aquades, and then the third one we use papaya leaf extract 100 milliliter. And the tools in this research, we use pH meters, and also we use electric scales, and also we use measuring cups and vials, and also we use watch glass and magnetic streeter, and then we use ultratonic, and we use Saltec bed, and the last we use particle size analyzers. And next, for the procedure or for the step for making the liposome extract, we use 1.0025 grams of soy lecithin polycedin in 11.5 milliliter of distilled water, and then mixture of lecithin and distilled water was added with papaya leaf extract 0.5012 grams, and then we comparison of the lecithin and also papaya leaf extract 100 to 50, and then we stirring was carried out using the magnetic stir with the speed of 700 rpm of temperature of 40 degrees Celsius around 40 minutes. And then next, liposome formulation homogenized using ultra-therapeutic speed of 50,000 rpm for about 30 minutes, and sonicated using a Bart sonicator for about 30 minutes at 60 degrees Celsius. Next, and this is the document before, slide before. Okay, so you can see the documentation, and this is the tools that we are using. There are papaya leaf, soybean, and also there is a glass and stirring, and etc. Next, for the result, you can see on this table there are sample 1, 2, 3, and 4, and for the average for the pH, we can see the pH is 5.45 and the PSA is 15.46. And next slide. So it can be concluded that the formulation of nanoliposome preparation from phospholipids from papaya leaf extract with the addition of soy lecithin or can be done using a combination of UC halting method and 30-minute sonication. And the suggestion from the next researcher, it is needed regarding the optimization of temperature and also the length of the sonication in the manufacture of nanoliposomes and observation of the morphology of liposomes produced using transmission electron microscopy. And the final product of this liposome from papaya leaf extract shows particle size distribution with the SILAS 190 liquid method obtaining range 0.04 millimeter and to 500.00 micromilli and 100 classes. The mean pH is 5.45 and the mean PSA is 15.46 micromilli. And we use some reference, but we just mentioned some. The Ministry of Research High Technology Indonesia, Institute of Health Science Mitra Husada Kediri, and Pharmacy Laboratory Department of Brawijaya University. I think enough for my presentation. Thank you for your attention. Thank you and see you next.
Okay, thank you, Miss Arina, about the presentation about the use of sonication method for reducing size of liposome in papaya leaf extract or Carica papayalin preparation as a candidate in treatment of cervical cancer. And then we move to the next participant. We move to the next participant. Please welcome Ms. Dita Kurniasari with the title, The Effect of Flank Illness and Study on Stress Level with the Impact of Quality of Life. Time is yours.
Okay, thank you for moderator. And Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
Morning all. Good morning all. Let me introduce myself here. I am Dita Kurniasari. I am lecturer in IKA Strada Indonesia. Especially I work in nursing and midwifery faculty. Okay, I will explain about the effect of flank illness and stadium on stress level with the impact on quality of life in chronic renal failure patients. And this research was conducted by the first researcher, Emma Mayasari, and then me, Dita Kurniasari, and Muhammad As'ad, Pancara Dono, Teti, and Putri. And next slide. Explain about background. Okay, for introduction, the condition of patient with chronic disease is often found to have psychological disorder. And psychological disorder that are not handled properly in patient with chronic disease that are not handled properly in patient with chronic disease will aggravate the pain and reduce the quality of life. And then the result for study conducted by Hill et al. In 2016 with a systematic review and meta-analysis research method obtained that a global prevalence of chronic kidney disease of 13.4%. And from Riskesdas in 2013 shows that the prevalence of the Indonesian population suffering from kidney failure is 0.2% or 2 per 1,000 population. Meanwhile, in 2018, the prevalence of chronic kidney disease increased twofold from 2013 to 0.38%. And next slide. Okay. For research method, this research method uses cross-sectional analytic, which aims to analyze the effect of length of illness and stage on stress and its impact on quality of life in patients with chronic kidney disease. And the population in this study were all chronic kidney failure patients undergoing hemodialysis at the Gambiran Regional General Hospital Kediri. And samples were taken by accidental sampling with the number of research samples that met the inclusion criteria as many as 92 people. And data collection tools for length of illness and stadium using a questionnaire, stress level using the DAS scale, and the WHO QL quality of life scale. Okay, and analysis using PET regression analysis. Okay, next slide. For the result, the first for description of variable, The research showed that the average length of illness experienced by respondent was 2.1 years. The average of CRF stage experienced by respondent was at the 2.7 level, and the average of stress level had a value of 21.1, and the average value of quality of life that is on is 39.8, and the duration of illness experienced by the respondent has a minimum of 1 year and a maximum of 4 years. And the minimum of CRF stage is at stage 1, and the maximum is at stage 5. For the minimum stress level, the value of the respondent is 17 and maximum of 30. And the value of the quality of life of the respondent is at least 17 and maximum 78. Okay, next. The second, for analysis, we have two models in this research. Yeah, the first model is a research analysis of the effect from duration of illness and stage of CRF on the stress level of patient with chronic renal failure. The first model is show that the effect of duration of illness and stage of CRF on stress level is 46.9%, while 53.1% is the contribution of other variables that are not included in this research data. Okay, next. And the second models, we analysis of the effect of duration of illness and stage of CRF stroke level, stress level on the quality of life patient with chronic renal failure. And for the second model, we have data. Yeah, this the meaning of the analysis results is that the longer a patient has chronic kidney failure with a higher stage level, and the heavier the stress level and the lower the quality of life. Okay, next. And discuss for the fact in slide before, yeah. We have theory from Ibrahim 2020. Namely that stress effects help in two ways. Yeah, the first is change caused by stress directly affecting to the physical function, and then the second way is stress indirectly affects individual behavior. Okay, the next slide. Okay, for this fact and theory, we conclusion that if the length of illness experienced by the respondent can affect the psychological condition of chronic kidney failure patients. In addition, the stage experienced by the respondent is in this study were on average at stage 3, and they have experienced a decline in the function of their organs. So they feel that there is a deficiency in the this patient's condition causes the patient to experience stress. Most of the respondents often experience irritability when facing minor problems, feel impatient to get better soon, and feel uneasy and anxious every day. Okay, next. And the conclusion is that the longer a patient experiences chronic renal failure with a higher stadium, the heavier the stress level and the lower the quality of life. So therefore, in addition to focusing on physical therapy, it is also important to teach maybe relaxation techniques so that sufferer can cope with the stress that comes from their illness. Okay, next. Okay. Thank you. I think that's all for my present. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, Miss Dita, for the presentation about the effect of leg illness and stadium on stress level with the impact of quality of life in chronic renal failure patient. And we move to the next participant. Okay, we move to the next participant. Please welcome Ms. Sri Rahayu with the title Effect of Prolanic Activity on HbA1c Profile in Diabetes Mellitus Patient. Time is yours.
Do you hear my voice?
Yeah, I can hear you.
Yeah. Okay. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning.
Excuse me, Miss.
Thank you.
Your voice is too tiny. I cannot hear you clearly.
Okay. Okay. Now, do you hear my voice?
Louder, please.
Okay.
Okay.
My voice. Okay. Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning.
Waalaikumsalam
Thank you for
warahmatullahi
your
wabarakatuh.
time. Now I will present our research with the title Effect of Prolanic Activity on HbA1c Profile in Diabetes Mellitus Patient. Thank you for my
Miss Sri Rahayu, I'm sorry, I cannot hear your voice.
Okay.
I still can't hear your voice.
Okay, test. Do you hear my voice?
Yeah, I can hear you.
Okay, clearly?
Not really, but I can still hear it's better than before.
Okay.
Maybe you can say it louder?
Okay. Now, do you
Yeah,
hear my
okay.
voice?
Yeah, I can hear you.
Okay. Okay. Now I will present our research with the title Effect of Prolanic Activity on HbA1c Profile in Diabetes Mellitus Patients. Next. Thank you for my team, Vici Setiawan, Hani Mariana Dewi, Arif Wijayanto, Nur Wijayanti, and Hani Kusumawardani. Beforehand, the outline of my presentation is introduction, method, and result, and conclusion. Next. What is diabetic mellitus? Diabetic mellitus is a heterogeneous group of metabolic disorder characterized by hyperglycemia. It is associated with abnormalities in carbohydrate, fat, and protein metabolism and may result in chronic complications including microvascular, macrovascular, and neuropathic disorder. Criteria of the DM: fasting plasma glucose more than 126 milligram deciliter or 2 hours plasma glucose more than 200 milligram per deciliter or H1c value more than 6.5%. Random plasma glucose more than 200 milligram deciliter. Long-term effect of diabetic mellitus, complication of retinopathy with potential blindness, nephropathy that may lead to renal failure, and or neuropathy with risk of foot ulcer, amputation, cortical joints, and further of autonomic dysfunction, including sexual dysfunction. The chronic disease management program or Prolanic developed by the BPJS in collaboration with first level health facilities seek promotive and preventive measures to control the glycemic index of diabetic mellitus patient. Next. Infographic of DM. Diabetic progression is estimated reach pandemic proportion over the next 10 to 20 years. And then in most Western societies, the overall prevalence has reached 4 to 6% and as high as 10 to 12% among 60 to 70 years old people. And then International Diabetic Federation data indicate that by the year 2025, the number of people affected will reach 30 million to 90% of these people have type 2 diabetes. The annual health costs caused by diabetes and its complication account for around 6 to 12% of all healthcare expenditure. Next. A1c test. What is that? A1 is A1c reflect the average glycemic over approximately 3 months. Measure tool for assessing glycemic control and has strong predictive value for diabetes complication. Should be performed routinely in all patients with diabetes in initial assessment and as part of continuing care. Measurement every 3 months determines whether patient glycemic target have been reached and maintained. The frequency of A1c testing should depend on the clinical situation, the treatment regimen, and the frequency of A1c testing should depend on the treatment regimen. The frequency of A1c testing should depend on clinician judgment. Next. Next. Okay. Research method. This study is an analytical study using a retrospective cohort design. The location of the research was carried out at UPTD Puskesmas Ngletih Kediri City. The research data is secondary data obtained from the total sampling of medical record of patient diagnosed with DM and undergoing treatment, either receiving insulin or oral anti-diabetic drugs. Observation were made by taking the patient medical record data for months from January and April 2019. Next. The inclusion of this study were all male and female patients over 20 years of age, registered and as member of the BPJS. The exclusion criteria were GM patients who did not have A1c on measurement in April 2019. Next. A retrospective cohort study was conducted using two groups, namely a group that always participate in pro-Lanis activities every month and a group that did not regularly participate in pro-Lanis activities. The comparative hypothesis test was conducted to determine whether there was a difference between the two groups. An independent t-test was used if the data were normally distributed, or the man-Whitney test if the data were not normally distributed. The result of statistical test is significant if p less 0.05 with a confidence interval of 95%. Data management used the statistical package for the social science program. Next. The result of our research. The result of our research will be present in several tables. The first table is about basic characteristic of diabetes mellitus. Table 1, from the result of the study, it was found that most DM patients were women as much as 82% in group 1 and 85% in group 2. And then this is in line with the result of the 2018 risk studies, which showed that the prevalence of DM was higher in women than men. Many factors that thought to cause the high prevalence of DM in women, including genetic factor, environment, lifestyle, low physical activity, obesity, to a history related to varieties such as a history of gestational diabetes and a history of having given birth to a baby weighing more than 4,000 grams. Next. In table 2, in this study, the GDP value of patient in group 1 was more controlled than GDP in group 2. There was a significant difference in the value of GDP in the two groups. Patients who had controlled FPG level had controlled HbA1c value as well. Through the correlation test, it was found that there was a strong correlation between the GDP and the patient HbA1c value. This is in line with a meta-analysis study which stated that 7 of the studies included in the meta-analysis found better correlation between GDP and HbA1c, while the remaining 3 studies reported better correlation between GDP and HbA1c target. Next. In table 3, the result showed the HbA1c.
Sorry, you have 2 minutes left.
Okay. Profile in group 1, so the controlled profile compared HbA1c profile in group 2. Next. Next. This. Okay, conclusion. The optimal utilization of propionate activities is very effective in controlling fasting blood sugar and HbA1c in patients with type 2 diabetes, so that it indirectly prevents complications. This is evident by the significant difference in the HbA1c value of DM patients in the group that routinely participate in Prolanis activities and in group that do not routinely participate in Prolanis activities. The mean HbA1c value in patients who routinely participate in Prolanis activities was more controlled by than the mean HbA1c in patients who did not routinely participate in Prolanis activities. Okay. Next. Okay. This is the end of my presentation. Thank you for your attention, Ms. Vicky.
Okay, thank you for the presentation about the effect of Prolanis activity on HbA1c profile in diabetes mellitus. So, we move to the last participant for the first session. Please welcome Miss Dr. Nur Wijayanti.
Okay, time for me. Okay, direct. Okay, thank you very much, Bobby. I want to present my research, the title, Test of the Extractive Effectiveness of Linea Orange Leaves Citrus auratifolia on date of IGT. Deliberate, the new hemorrhagic fever is a fever caused by the pit of the IGT mosquito, which cause red spot on the skin and bleeding that comes out through the nostril, ears, and the other. The HF is caused by the new virus, a type of virus that is classified as airborne virus and enter the patient body through the bit on the IgT male mosquito, especially attack adults and adults, which often cause death severe. Next, the pathology of the death process of the IgT mosquito larva as the cause, because only in the body of Aedes mosquito the virus can be applied there. Therefore, the benefit of lime leaf will help eradicate mosquito larvae, because by taking the oil extract in lime leaves and spray in the bed or puddle at home, which contain lemon compound, and the function of it is too toxic to stomach of Aedes aegypti mosquito. The purpose of this study was to explain the effectiveness of leaf extract citrus aurifilus on the death of Aedes aegypti mosquito larva. Next. Research method. This type of research is experiment. The method in this study was a randomized block design method, RAK, namely the study was conducted using for concentration control 10% dose, 15%, 20% doses. Different line leaf extract, citrus aurifolia. Twice replication for each. The research sample take 10 Aedes aegypti mosquito larva for control and its treatment with consideration for the experiment of larva. So that the total number larva need is 18 larva. If were analysis used to weigh ANOVA analyze test significant p-value 0.00 less than 0.01. Next. Research result. The based on table 1, the most larva mortality with the profiles of leaf extract, citrus auratus with 20% of doses, both in the repeats 1 and 2nd for the first and is 4 larva, and the second is 5 larva, and there is 10 days that the higher the doses, the more death of the larva. Table 2, based on table 2, the most larva mortality with in the provision of lime leaf extract at the dose of the 20% about in the first and second repeat. The first is 5 larva and the second is 4 larva, and there is a landacid that the higher the dose, the more death of the larva. The next, table 3, based on table 4.3, the most larva that were in the process of lime extracts at doses of 20% about on the first and second repeat. The first is 1 larva and second is 1 larva, and there is 10 days that the higher the dose, the higher death of the larva. Based on table 2, there is an effective of the dose of lemon extract citrus with the mortality of Aedes aegypti mosquito larva p-value 0.00 less than 0.01. So who is the rejected? There is no effective of the children of giving leaf extract with the mortality of Aedes aegypti mosquito larva p-value 0.075 more than 0.01. So who is accepted? There is no significant interaction between doses and duration of the concentration of leaf extract with the mortality Aedes aegypti mosquito larva. Next, discuss duration of giving citrus aurifolia leaf extract and mortality rate of Aedes aegypti mosquito larva. Based on observation during the first 3 hours of control, no larva died and the mover was clear active. For the doses treatment, there were several dead larvae and the movement of some mosquito larvae become less active. There is a tendency that the higher the dose has been, the more larvae that leaf extract in treatment plus the look breed and stable to dress of mosquito metabolic system. The same thing happening on the same second repeat during 5-6 hours observation of control without treatment. None of the larva died and larva movement was still active. For those treatment, there was increase in the number of mosquito larvae dead and the larva movement was active. And leaf extract its treat dose. The color did not look like 3 hours. It did not look like root leaf extract dose, not work quickly like in the insecticide which kill mosquito larvae direct, but rather a way disrupt the metabolic system and the mouling process of the larva. Based on table 1, the most larva mortality for the 3 hours, 6 hours, and 9 hours trial in the control group without a give leaf extract were all the same. There were no leaf death. Mosquito larva mortality at dose of leaf extract. The best on table 1. It is now that the most larva mortality for 3 hours trial was in the administration of the leaf extract at the dose of 20%, but in the treatment 1 or 2, the first is 4 larva and the second is 8 larva, and there is a tendency the higher the dose, the more larva died. This condition also occurred in 6 hours and 9 hours trial. The next, effective of lime extract on HSHT mosquito larva mortality between control and treatment in 3 hours, 9, 8, 6, and 9 trial. Based on table 2, it is now that there is an effective of the dose of leaf extract on the mortality of HSHT mosquito live p-value 0.00 less than 0.01, so who is rejected. Conclusion and recommendation. The most conclusion, the most deaths of mosquito larvae were found in the 3 hours, 6 hours, and 9 hours trial. In the length of time give the leaf extract, so that is higher the dose given, the more mosquito larva deaths. Most larva mortality for 3 hours trial was at the dose of neem leaf extract with the dose of 20%, both in the treatment 1 and 2nd. Namely, the first 4 larva and the second is 8 mosquito larva. This condition also occurred on 6 hours and 9 hours trial. There is effective of the dose of leaf extract on the mortality of Aedes aegypti mosquito. P-value 0.00 less than 0.01. So who is the rejected? Suggestion for the researcher, it is a
Excuse me,
suggestion to...
Dr. Nurwijayanti, I'm sorry. Your time
Yes,
is up.
okay, I think enough. Suggestion is not, I read. Okay.
Okay, Dr. Nurwijayanti is the last participant for the session 1, and then we move to the next session, is the discuss session, and in here we have 2 questions The first is from Dr. Yuli Peristiawati to Dr. Sentot. Why mechanism plasma convalescent for COVID-19 in Indonesia? Dr. Sentot, can you hear me? Dr. Sentot? Okay, we move to the next question. Oh, sorry, this question is also for Dr. Sentot. Dr. Sentot, can you hear me?
Okay.
Okay, we have two questions for you.
Yes.
The first is from Dr. Yuli Peristiawati is why mechanism plasma convalescence for COVID-19 in Indonesia? And the second is question from Wiwin Sulistiawati. Which one do you think is more effective between drugs and plasma therapy for COVID-19 therapy in Indonesia?
Okay. Is
Okay.
my voice clear?
Yes, I can hear you
Yes.
clearly.
Thank you. With your question, Mrs. Dr. Julie, about plasma convalescent. Plasma convalescent is therapy for the man or the woman, the patient in several case. Several case patient is maybe the patient in intensive care unit. Yes. In intensive care unit, the patient maybe with dyspnea, yeah. Hello, okay,
Oh, I can hear you.
yeah, okay,
Okay, is that enough for the question number one?
yeah. Number one is
Enough. Okay.
several patient with COVID infection.
Yeah.
Like this, the patient in intensive care. And what about uh, uh, to define the oral multi-drug and plasma convalescent. Multi-drug is a patient mobile and isolation to patient with isolation independent or isolation in hospital with comorbid, not intensive, but convalescent only to patient with uh, intensive care unit. It's okay.
Okay, so that's the answer for the question number two. And then we have another question for for Dr. Nurmi Jayanti. What do you suggest for the next experiment beside the method of wrapping the extract? Dr. Nurmi Jayanti, can you hear me? Dr. Nurmi Jayanti, can you hear me?
Yes,
Okay,
yes.
there is a question for you. And what do you suggest for the next experiment beside the method of wrapping the extract?
Okay, thank you very much. I will try to ask for the next researcher. It is suggested to the next researcher to study the extract technique by wiping the extract of the leaf and dipping in the mosquito larva that have been provided for the research. Also, I think the length of the time to give is the most effective. Yeah. There is for the next researcher. Length of time to give is the most effective because there is near the research. And for the next is very a lot of for the variable, the other for the for the flat doses and uh, the other for the lim citrus.
Okay, is that enough?
Enough.
Okay, thank you for both of you, Dr. Sentat and also Dr. Nurwijayanti. So after this, we come to the last session. For the first session is to take a break. It's about 5 minutes. But before that, please turn on your camera because we're gonna take a picture together. Please turn on your camera. Okay, all of you, please turn on your camera. We're gonna take a picture. Okay, please for Susianti, Teti Ripursari, Winda Trisnawati, Zarawan, and all of you, please turn on your camera because we're gonna take a picture together for the last session. Okay, please turn on your camera. Okay. Doc, please, Miss Susiati, can you turn on your camera? Okay, I'm gonna count 1, 2, 3, and then we're gonna take a picture. 1, 2, and 3. Okay, that's enough. And we have 5 minutes to break, and then we move to the next session. Is the session 2.
Yes, enough. Yes, I leave. Okay.
For the moderator,
So please
the
stay
last the
here.
session is
Please stay here. Do not leave the station, and then don't forget to fill the absent. We already put the link on the column. Please absent your name and don't leave. Please don't leave this room.